It is a hinge type of synovial joint. The articular surfaces are the upper articular surfaces is formed by the capitulum and the trochlea of the lower end of the humerus, and the lower articular surface is formed by the upper surface of the head of the radius and the trochlear notch of the ulna. The capitulum is rounded hemispherical eminence that possesses a smooth articular surface only on its anterior and inferior aspects. The trochlea is medial to capitulum and resembles a pulley. The medial flange of the trochlea projects to a lower level than its lateral flange. The trochlear notch of the ulna is formed by the upper surface of the coronoid process and the anterior surface of the olecranon process. The upper end of the radius is circular in outline and slightly depressed in the center. Relations to the elbow joint. Anteriorly, brachialis muscle, median nerve, brachial artery, and the tendons of biceps brachii. The last three structures are separated from the joint capsule by the brachialis muscle. Posteriorly, tendons of triceps and the anconeus. Medially, flexor carpi ulnaris, ulnar nerve, and the common flexor origin of the muscles of the forearm. Laterally, supinator, common extensor origin of the muscles of the forearm muscles, and the extensor carpi radialis brevis. Movements. It is a uniaxial joint. The elbow joint allows only flexion and extension. The range of flexion is about 140 degree. The movements and muscles producing them are flexion by brachialis, biceps brachii, and the brachioradialis, extension by triceps and the anconeus. The blood supply to the elbow joint is by arterial anastomosis around the elbow formed by the branches of brachial, radial, and ulnar arteries. Nerve supply of the elbow joint is by articular branches from radial nerve, musculocutaneous nerve, ulnar nerve, and the median nerve. Clinical correlation to the elbow joint. Nursemaid's elbow. It is due to subluxation of the head of the radius in preschool children of 1 to 3 years old, and here the head of the radius comes out of the annular ligament and the elbow is kept slightly flexed and pronated. Next is tennis elbow. Here the inflammation of lateral epicondyle due to the overuse of extensor muscles. Next is golfer's elbow. Here is due to inflammation of medial epicondyle due to the overuse of flexor muscles. And student's elbow, it is also called as miner's elbow. It is due to the inflammation of olecranon bursa.